What are the early signs of a lupus sun flare? Imagine your body suddenly reacting to something as simple as sunlight. For many with lupus, exposure to sunlight can trigger what's called a sun flare, which is part of the disease's complex nature. Lupus is an autoimmune condition where the immune system mistakenly attacks healthy tissues, and symptoms can vary greatly from person to person and over time. There is no single test to diagnose lupus. Instead, doctors use a combination of clinical signs, medical history, physical exams, and multiple laboratory tests to make a diagnosis. When a lupus sun flare begins, one of the earliest signs often noticed is a skin rash. The most characteristic rash is a butterfly-shaped rash across the cheeks and bridge of the nose, which can become more prominent after sun exposure. This rash is usually red, slightly raised, and may feel sore or tender. Some people also develop other skin symptoms like photosensitivity, meaning their skin becomes more sensitive and reacts quickly to sunlight, leading to redness, swelling, or rashes on sun-exposed areas. In addition to skin changes, systemic symptoms can also appear early in a flare. Fatigue is very common and can feel overwhelming, often worse after sun exposure. Joint pain and swelling may develop, especially in small joints like those in the fingers or wrists. Some individuals might experience mouth sores or ulcers that appear or worsen during a flare. Fever, even a low-grade one, can also be an early sign, signaling that the immune system is active and reacting. Diagnosing a lupus flare related to sunlight exposure can be tricky because symptoms like fatigue, joint pain, and skin rashes are common in many conditions. Doctors look for a pattern of symptoms that come and go, often worsening after sun exposure. They may perform blood tests to help confirm a flare. The anti-nuclear antibody test is positive in most lupus patients, but it is not specific to lupus. More specific antibody tests, such as anti-double-stranded DNA and anti-Smith antibodies, can provide additional clues. Blood counts may reveal anemia or low white blood cells, and urine tests can show signs of kidney involvement, which sometimes occurs during flares. It's important to remember that lupus symptoms can fluctuate, with periods of worsening called flares and times of remission. Sunlight can be a trigger for some, so protecting skin with clothing, hats, and broad-spectrum sunscreens is often recommended. But every person's experience with lupus is unique. Some may have more skin sensitivity, while others might experience more joint or systemic symptoms. If you notice skin rashes, increased fatigue, joint pain, or other symptoms after sun exposure, it's essential to consult a healthcare professional. They can evaluate your symptoms, run appropriate tests, and help determine if you are experiencing a lupus flare. Managing lupus effectively involves understanding your individual triggers and working closely with your medical team. Remember, while lupus can be challenging, many people find ways to control symptoms and live full lives with proper care and support.